My name is Tamar, and I'm going to tell you about what happened to our beloved daughter Liel in the healthcare system. But first I want to ask you, have you or someone you love ever had a bad experience in the healthcare system? Like a doctor dismissing your symptoms when you are clearly suffering, or not being given enough time to share your symptoms before the doctor has to move on to the next patient, or being told that the reason you aren't getting better is because you're doing something wrong, or worse, being treated as if you are wasting a provider's time and left feeling that you're undeserving of kindness and care when at your most vulnerable. If nothing like this has happened to you yet, I'm sorry to tell you, almost everyone is going to be negatively impacted by our industrialized and indifferent healthcare system. Though our daughter wasn't lucky enough to survive it, I hope that you will. Consider this. Doctors only spend about 11 seconds listening to patients before interrupting and diagnosing them. There are 12 million diagnostic errors each year. 1 out of every 4 patients leaving the hospital has experienced at least one medical error, and 800,000 people die or are permanently disabled each year because of misdiagnosis, making medical error the 3rd leading cause of death in the United States. Clinicians spend close to 50% of each doctor's visit charting, making it impossible to give patients their full attention. Even caring and talented doctors are often unable to truly help because of the insurance-driven conveyor belt system that severely limits their time, prioritizes charting over care, discourages collaboration, and has stripped the humanity out of most patient interactions. Though we're grateful to the handful of doctors who cared about Liel's failing health, mostly during Liel's horrible illness, we experienced a level of indifference and cruelties and medical disregard so consistent that it was not only shocking, it was deadly. In the midst of our immense grief, the nonprofit organization, The Patient Revolution, is giving us some rays of hope that someone else's loved one may not have to go through what Liel and we did. TPR is innovating better and more sustainable healthcare models and pushing through the many obstacles to care that we've allowed to become the norm, despite how dangerous and dehumanizing it is. The Patient Revolution is making our healthcare experiences safer, more empathetic, less burdensome, and will ultimately save lives. Here's our Liel's story. At 18, when we noticed Liel's first unusual symptoms, we took her to a world-renowned medical center known for diagnosing complex diseases. They had access to her labs, could see her extreme weight loss, and observed her having multiple seizures. Liel reported on her constant pain, her vomiting, episodic paralyzations, and other debilitating problems. But after a brief exam, the doctor told us that given Liel's issues as a young teen, mental health issues, all of her symptoms could only be caused by a mental health disorder, and suggested that she go to therapy. I want you to imagine your child can barely get out of bed in the morning. She is 30 pounds lighter than she was a few months ago. She's having seizures. Her stomach no longer works. She is so miserable, and their answer is go to therapy. Even though there was ample evidence to the contrary, once that absurd diagnosis was put in her chart, it created a diagnostic momentum, becoming the starting point for every doctor after that, and keeping them from looking for the real reason for her failing health. Her care then had to be spread among multiple specialists, only looking at their piece of the puzzle. We begged them to coordinate, but instead each prescribed their own medications, their own operations, and Liel only got worse. And I just want to show you, this is what that looks like. 200 medications over a short period of time that no one was paying attention to except for Liel, any combination of which could have killed her. But that's what our system is right now. Throughout her illness, Liel was made to feel that she was wasting doctors' time and unworthy of their care. She was spoken to rudely and cruelly and was gaslit repeatedly, told that she wasn't suffering the way she reported because she wasn't really sick. It was all in her head. Liel told us that how she was treated in the medical system was worse than all of her pain and disabilities. Finally, at a private clinic, they did testing never even mentioned before, revealing that Liel had a serious mitochondrial disease. 2.5 years after this medical nightmare began, after multiple operations, emergency hospitalizations, and now weighing just 80 pounds, they finally did a hospital review of her case. And we were told that her organs were by then failing and it was too late to save her. She went on hospice and died shortly after her 21st birthday. No one should ever have to watch their child or any loved one suffer or die unnecessarily because of the failings of our broken and often heartless medical system. Liel actually made us promise that we would tell her story to inspire real change in hopes that her death might save others' lives. That's why we've partnered with the Patient Revolution, which is doing the work to transform our healthcare system from a failing industrialized model to a deeply human one. I hope you'll join me in making a generous donation to support the Patient Revolution's efforts to ensure that we all receive the careful and kind care we deserve and that will save lives. On behalf of our beloved daughter, Liel, thank you for partnering with us.